My name is Cecilia Wairimu Ngare. I'm a public health and clinical research scientist working with the Kenya Institute of Primate Research. This is a biomedical research institute under the Department of Public Health and Professional Standards. So what we are doing currently in Siaya County and across other counties is we are mapping snakebite hotspots. We started this in Turkana County, and we are hoping to mark out across the entire country. So we want to identify within the country which regions have a higher incidence of snakebite, and also within the counties we are doing intra-county mapping. So we identify sub-counties and wards that report or that have a high snakebite incidence. So we are working very closely with the Ministry of Health, Siaya County, who have given us the permission and who have also identified for us community health promoters who are very key in identifying households, which then we are interviewing household members to try and identify some of the risk factors that expose a different community to snakebite compared to the other. So additionally, we are also capacity building the community health promoters. So we are sensitizing the community health promoters on snakebite prevention and control. We are also talking to them very deeply on first aid measures for snakebite and what to do, what not to do when a person within their community is bitten by a snake. So we will also or are also interested in educating healthcare workers, and specifically and especially in those areas and those sub-counties that we will identify as a hotspot for snakebite. So we will be talking to healthcare workers so that we understand the challenges they face every day when managing snakebite, and we also try and educate them or train them on how to adequately administer anti-venom, some of the side effects of the anti-venoms that we have, and what to do or how to manage a snakebite victim or a snakebite survivor until full recovery. Thankfully, and to the Kenyan government, we have our institute has been mandated and also funded to develop a locally available anti-venom. This is because of some of the research that we've been conducting in our institute, which has previously proven that some of the anti-venoms that we had before were not very efficacious or were not very strong towards managing snake bites within the country. So when we did this research, then the government went ahead and funded the institution to develop a local anti-venom using our own snakes. So the institution, which is in Karen, has taken up this mandate to. It's a long process, but in future we are hoping that once we have this anti-venom, we'll be able to distribute it, or the government then will be able to distribute it through the agencies that does drug distribution to counties, so that and hopefully it will reach to the target people, which are the community members, the community members being afflicted by snakebite. So this activity that we are doing here will greatly help in identifying some of the facilities which will benefit, and some of the community members which will benefit from the anti-venom that the government is trying or is going to come up with. In a nutshell, it means that we use snakes or venomous snakes from the country. Some of the snakes, especially in Siaya County, include the black-necked spitting cobra. So we use these snakes and their venoms to develop their antidote, the anti-venom. So previously, the anti-venoms that we've had were coming from other countries, or were coming from other countries such as India, and they were using Indian snakes to develop these anti-venoms. Now we want to focus our energy and our research on developing anti-venoms that are from the Kenyan or the region's snakes. This will improve on how fast the anti-venoms work, and will also mean that we will use smaller doses of anti-venom to treat a snake bite as compared to previous doses that we've been using. We work very closely with KWS, Kenya Wildlife Services. We work with other agencies, government agencies, to get these snakes, to house these snakes, and then we milk or we harvest their venoms. This venom is then what we use to develop the anti-venom. What we have, the statistics that we have currently is provided by the Kenya Health Information System, and this is statistics where statistics which are reported by the health facilities. So all snakebite patients or all snakebite patients who are bitten by a snake and report to a facility are then captured in the Kenya Health Information System. So what we want to do now is improve this by targeting or by capturing even those incidences that do not get to the facilities, which usually the biggest problem with snakebite, that it is underreported, especially for community members who do not get an opportunity to visit a health facility. So there are some herbs which research has been conducted and has proven to be insufficient in treating snake bites. They do not work at all. And the biggest problem we have is that when community members use these herbs, sometimes they take time. Snakebite is a time event. The more time you take to get to a facility, the more you risk it. The more the risk of developing a more serious complication from the snakebite event itself. So what community members and what we are trying to sensitize the community members is that because now that we have Siaya County has anti-venoms in the different facilities, the most important thing for a community member who's been bitten by a snake is to rush to the health facility. The more time you take to get to a health facility, the more risk you are in getting more serious complications.
So as a research center, you don't encourage the use of this local intervention?
We do not encourage the use of local interventions because it is time wasting.
I'm Charles Odur. I coordinate the neglected tropical diseases. Today we are in the field with the Kenya Snakebite Research and Intervention Institute. So what we are trying to do, we are just trying to map out snakes that are in Siaya Center so that we are able to know where they are concentrated most, where snakes are concentrated most and why, and also which type of snakes are in those areas. And also we are carrying out interviews in the households to know which area is most affected by snake bites. And this will assist us as a county to take the anti-snake venoms to the nearest facility. Because when you are bitten by a snake, it's a matter of hours before you are overwhelmed. So it is important that interventions come within a short period, and that's why we are mapping so that we know exactly areas that are most affected. At the same time, you find that most people, that when they are bitten by snake, they don't seek help in health facilities. So you want to know the reason why they don't seek help, and by that we are going to give them information, the importance of seeking help in a health facility. And since we are dealing with a research institution, they'll also do research on the traditional ways that we use to intervene when somebody's bitten by a snake, whether they are working or not, and then give right information. Us, we prefer that people go to the hospital when they are bitten, because we have medicine. We have the snake venoms in our health facilities. So referring people on time is very important for quick recovery. Also, the Kenya anti-snake bite and intervention center, they are trying to come up with anti-snake venoms that are specifically produced in Kenya, because you find that the anti-snake venom that we are using currently is imported from India and might not be as efficacious as the one that would be able to get when we get from the snakes that are specific in Kenya. So they will come with they'll come and take the snake venoms from specific snakes, and then go and get the anti-venoms that are specific to the snakes that are in Kenya. And that will be very, very important for quick recovery of anybody that is bitten by the snake. Also, the snakes would want to know which areas we have the most poisonous snake. Like we know in some areas in Siaya County, we usually have the spitting black cobra, which is very, very poisonous. And it is important that if you are bitten by a poisonous snake, you are rushed to a health facility within hours to get help. So apart from that, they are also in the process of training for us healthcare workers, so that they are able to manage the snake bite more effectively, and also train community health workers so that they are able to give information about prevention and control, how to prevent snake bites, and also to have the proper information if you are bitten to the snake bite, the first aid that you could do, and also the importance of going to the health facility on time before a lot of delay is before somebody delays with the treatment. So good health-seeking behavior when you are bitten by a snake, those are the information that we would want the community to know, so that they go to the facility and they are treated on time. You find that in Siaya County, we have cases of snake bites, and if you go to Kenya Health Information System, we have like 2 or 4 snake bites per year on average, and per month around 17 snake bites on average. So this shows that actually this is a problem that we need to deal with. And remember, if you are bitten by the poisonous snakes, then it's an emergency and you require health treatment urgently. And we would prefer that if you are bitten by a snake, then you go to the health facility. You don't go to traditional health, traditional healers or people that use traditional medicine, because scientifically we might not know how efficacious they are, whatever they are using. And in most cases, they delay